welcome everybody to Natural Image OC's first webinar ever. And I have with me my two lovely providers, Polly Vallone and Chelsea Darling. And of course I'm Dr. Sikorsky. We are going to be presenting some demonstrations. All of us will be doing a patient and show you how we use the new product called RH and the new RH product called Redensity. And also I wanted to share with you that we are one of the first practices in the United States to get the new long-lasting neurotoxin, which is called Daxxify. So we're really excited about that. We were also one of the first practices to get the Revance line as well. As you know, we are very forward-thinking and cutting edge. We have all the newest, latest, and greatest. Considering we're a little boutique practice, the three of us, we try to provide you with all the current and best fillers and treatments available at this current time. So we'd like to welcome you again and also tell you, if you stay to the end, we will be doing a drawing for those that stay to the end after the Q&A. We'll have a Q&A so you can ask specific questions. And there'll be a drawing for a free syringe of the Revance products. You can choose which one you would like. And what else? Oh, we are also offering $100 off a syringe, each syringe of the Revance products. So if you get one syringe, it's $100 off. If you get 5 syringes, it's $500 off. So welcome, and I hope you enjoy our first webinar. Thank you. So why did I bring RHA filler and Daxxify into the practice? Well, the reason simply is that Daxxify is a novel neurotoxin that lasts longer, and so we wanted to provide our patients the convenience of twice a year tox treatments. Because a lot of our patients are very busy, and it's easy to combine your tox treatments with your filler follow-ups and treatments, which typically are about twice a year. As far as bringing in the Revance line, the variety from the Redensity, which is very, very light, to the RH4, which is more robust, it gives us 4 levels of treatment, and it has this ability to move with the skin.
RHA is different than other fillers because of the way it's made. It's made to resemble more of our natural hyaluronic acid, and that's because it's a longer chain of hyaluronic acid than the current fillers out there. So it mimics and grabs into the skin and integrates into the skin better than some of our current fillers.
Okay, so Daxxify, the new neurotoxin, it's different than other neurotoxins because it's has only one with a positively charged peptide, and that surrounds the neurotoxin, so then when it is binded to the neuromuscular junction, it stays a lot longer. So this toxin is going to last twice as long as your typical Botox or your Dysport, so it's definitely a new novel therapy that we're excited about.
So who is the best candidates for Daxxify and for Revance and Redensity? Basically anybody that's busy and wants to do twice a year tox treatments to stop the movement.
Busy, very busy mom. I would love to only have a 2-time stop. I would love that.
Yeah, so it's great. I agree, because what happens to me is my toxin wears off, and then it takes me 2 months to get around to capturing Polly or Chelsea to do it, because again, we're really busy, and it's hard to take the time out, you know. So anyway, so for busy people, I think it's, you know, it's really great. And then also for the filler, it's really for anybody that wants to soften, just like Botox gives you, or Daxxify or any of the neurotoxins gives you a soft, rested look. The fillers are great for anybody that has actually fat loss in their face. If you have fat loss in your face, which actually occurs as we age, we lose some of these deep fat pockets. And when those deep fat pockets turn from, like, let's say, a grape to a raisin, then we start to get hollow and we look older. And so by filling deep in these fat pockets, we can improve our projection, we can look more youthful, and we don't look unnatural, because, you know, the most important thing with any of this is a very natural look. So as you know, we are very natural. Our name is Natural Image OC. Mm-hmm. We don't believe in overfilling people, and we also take into consideration the dynamic movement of the face. So what that means is when you smile, we want the fillers and the toxins and everything that we've done to look really natural.
Hi, I'm Chelsea. I'm a PA here at Natural Image Dermatology, and today I'm here with my patient Marie, and we are going to work with our RHA line collection of fillers. They're a really great filler collection because they're very natural, they're very dynamic and move naturally with your natural movements. So here today with Marie, we are going to, so she doesn't like how her temples, she's kind of losing some volume in her temples here. So we're going to replace that deficit with some RHA2. And then we're also going to put our RHA3, which is a little bit, the next little bit thicker filler, and that will help to lift her cheek. And when we lift the cheek and offset this temple here, it will help with this nasolabial fold. So, and then lastly, we'll fill through here with a little RHA3 for that nasolabial fold. And then lastly, I'm going to have her purse her lips. And you can see how she's got some lip lines here around her lips. So we're going to use the newest filler they have, the RHA Redensity, which is a really great filler for those lip lines. It's really natural, doesn't get too bulky, so it's a really beautiful filler there. So we're going to put that in her lip lines, and then we're going to also do a little bit on her border and do a little touch to her lip just to give her a little more volume.
I'm Polly. I'm one of the providers here at Natural Image. Today we're going to have this beautiful model filled with our RHA products, which we really have come to love. We're going to do a little filler in her temples, and then we're going to soften her cheek and make her look a little less tired, which is something she wants to do, by putting some RH4 here, putting some structure back in her face, and then we'll see how that does, and then probably come down and work with a little of the softer RHA products on RHA3 or RHA2 for some of the shadowing that you're seeing here.
So Chelsea, we talked a little earlier, but I always usually start at the top and work my way down. So if I look at analyzing your face, relax for just a second. Yeah. So, you know, you have really good light reflection on your forehead and a nice rounding of your forehead. Sometimes we actually will put a little like right in here, but we're not going to do that today. I think this is in the top portion of your face. This is the area that is showing a little hollowness, which is kind of aging you, because this is really beautiful and that's just a little hollow. People get hollow because of grinding. Sometimes they overwork their masseters, or from breastfeeding. It definitely causes, or people that are runners, this area gets very hollow. So this side is more hollow than this. So on this side, I'm going to do a technique where I come in here and I go in the middle layer. So there are 7 techniques for doing the temple, and we can go on the basement, we can go on the roof, so we can go on the floor, we can go on the roof, or we can go in the in-between layers. So this area I'm going to do on the in-between layers, and on this side I'm going to go more on the roof, much higher up. So this will be in the middle, this will be higher up. And we'll use different products on this side because you're more hollow. I'm going to use something called RH2. 2 is a nice soft filler. We don't want anything too thick in this area because we want it to be nice and even. So RH2, but it'll give us enough fill because you need more fill on this side. And then there's a product over here. We're going to go a little more superficial. It's called Redensity. It's a very light filler. It's the lightest of the collection. We always, Redensity, I think of as RH1, but it's the lightest. And then RH2 is a little bit thicker product, and 3 is a little thicker, and then 4 is the thickest. And these are like gels, if you think of them as squishy gels. They're hyaluronic acid gels, and they have a lot of flexibility to them. But in an area like this, you don't want anything too thick, and we're going to go actually high up so you can see imperfections, so you want something that's very smooth. And then as you go down the face, you have incredible cheekbone here, amazing. All your fat pads, both your deep and superficial fat pads, look amazing. You have a little bit of hollowing right here, and this is where I would put a little RH3. So you can see I'm going a little bit of a more robust product, and then here I might fill in a little bit of this to help your jawline swoop, and I would do RH3 there as well. And then here I'll either do RH3 or something called RH2, which is a lighter filler. And then in here I'm going to straighten your nose a little bit. I'm going to put a little bit in there. I might do RH2 there. I'm just trying to help this line be a little more straight. Sometimes I'll do a little bit in the chin. Your chin is actually really pretty, but if I were to do it, I would do it right in here and go right in the middle. So we'll see how that goes. And you have a little loss here. So have you noticed that? So we can put a little filler there too. And then we're going to put a little bit, your lip to upper lip to lower lip ratio is actually quite good. Usually we have a 1/3 to 2/3 ratio in Caucasians, and you are about 1/3 to 2/3, but it's nice to have a little more pouty on the lower lip, just a subtle, small amount, not a lot. And then I'm going to turn you this way, so we have the same thing here. We're going to fill in this little hollow so that we have a nice, and then a little bit here. It's important to fill the frame of the face. With you, the frame is actually more the area that we need more than the center portion of the face. Yeah, so that's kind of the plan. Does that sound okay? Okay.
Attending our event.
Keep an eye on your text messages because we'll be messaging you to book an appointment.
Make sure you keep an eye out because we have our free filler giveaway, and the winners will be notified in the next 24 hours.
Yes, and don't forget, each syringe is $100 off, no matter how many syringes you would like to purchase. Hello, everyone. everybody. So happy to have you all here tonight. We're so excited, Polly, Chelsea, and I, that you're all here with us. We're excited about educational events. We want to do more of these. So we're excited that you're interested. We have so much information, and we're bursting with excitement about all the things that are new in cosmetic dermatology, cosmetic surgery, and lasers and stuff. So again, welcome, and we'll start to answer your questions. Please ask whatever questions. We'll try to get to all of them. So the first question that I see in the box, someone asked, how many areas can I treat in one visit? And is there a limit? And as you saw in the last patient that I did, we did multiple areas. So, I really think of the limit is really what is going to look natural. And that depends on each person. I could have somebody that comes in and they might need very little. And then some patients who, let's say, the fillers are typically, to volume and lift. And so if someone is very, very more, thin or hollow in their face, or they might need more for various areas, but it really depends on the patient. And the goal is always natural, right? We want to look good, because we all know those patients and those movie stars that just have gone a little too far.
We're not going to take you too far.
No. Yeah, very patient specific. So.
Okay, what's the next question?
Okay. Who else do you want to answer?
How soon after I get my filler can I exercise or fly on a plane? I mean, you'll have some swelling and bruising after, but there's no limit on going on an airplane immediately after. So no restrictions in there. And exercise, I mean, you can exercise, I would say, that later that day if you're feeling up to it. So there's no really limit on that either.
Yeah, unless you really want to limit your bruising. If there's any sort of bruising, that high intensity exercise or something, if we say you might get a bruise and you ask us about exercise, we would say to limit any extra bruising, don't exercise. So if you don't care about any downtime, exercise your heart out.
I like to tell patients to exercise before they come in that day, and then the next day they can do whatever they want to do. We try not to bruise patients, and we're really, we've done a lot of things to reduce bruising. We do a special numbing cream that actually helps close the blood vessel a little bit. And we use oftentimes cannulas or little medicines that have things that can reduce bruising. So we really try not to. And we also have a laser that we do for complimentary that the patients can do either that day or the next day that can also reduce bruising. So, but yes, I think in general with even toxins, even Daxxify or Botox and any of the fillers, to try to get all your exercise in before you come in, and then just take the rest of the day, relax, and then the next day
pamper yourself. Yeah, you just have some fillers.
Yeah, with the toxin, we always say wait at least 4 hours for the toxin too, because you want it to set in. You don't want it to have movement and move. So.
Yeah, exactly.
It's important.
Yeah.
And then there was another question. Sorry, I'm going to scroll through about how soon before an event should you have this procedure done? So as far as fillers go, that one you just count on downtime, and usually we say a week of downtime, or if you want everything settled, I'd say 3 weeks to have everything settle in.
Yeah.
So it's not something you want to do the day before your wedding. As far as Daxxify, it actually sets in. That's the neurotoxin we're also talking about. It sets in very quickly, but I wouldn't push it to the end in case, again, you had some downtime or bruising, or we had to tweak some things.
Yes.
Yeah.
Thank you.
We agree. At least 2 weeks. Yeah, at least 2 weeks for everything.
Yeah.
Okay, so let me take this one.
How much is one syringe of filler? Can it be used all over the face? And what about the neck? So a syringe is it's $8.50, but if you guys book before this week, it's $7.50. You get $100 off. And yes, it can be used in multiple areas on the face. As you saw in the video, we do it in the temples, the cheeks, around the mouth. And we can do it in the neck as well. It's not as common there, but it definitely can be used.
That's actually a really great question.
Yeah.
The lines in the neck, like people get tech neck where they get these lines. RH1, which is the newest of this line, which is also called Redensity. We were one of the first groups to get this product. It's good in these lines like that. So we often at times combine it with Radius in the neck, which is a biostimulatory filler that actually stimulates fibroblasts to make more collagen and elastic fibers. So that combination is really good. You can sort of thicken the skin a little bit, and then with the lines, you do the Redensity. But in terms of the face, these products are very versatile because they have, I like to think about it like there's 4 levels. And so the first level is Redensity, which is the very fine, light filler. And then the RH4 is a little more robust. And so you can, use different fillers in different areas to get the result that you want. And so it's kind of fun. Like Redensity is great for upper lip lines, for those very fine lines. It's one of the best products out there for that because it's so fine. And some products will cause like a kind of picket fence kind of look, which we don't want. So I've been really loving it. How about you guys?
I love it. Well, and also number one, and you guys probably know this too, is when someone comes in, they say, okay, I want to work on my smoker's lines. I've never been a smoker. I don't work with these lines. I don't want my lips to look like a duck.
Yeah.
This is one of those products where it's like, oh, no brainer. Yeah. I'll give you some left definition. Don't be scared. And everybody, it seems like, I don't know if you have this too, but you show them the mirror and they're like, oh my gosh, these look great. It's nice and smooth. It really is one of my favorite products.
Like the best one for the upper lip lines.
Yes.
Yeah.
It's very, very natural looking.
So how many vials are usually needed? And I think we talked a little bit about this earlier. So on the upper lip lines, you would only use 1 syringe of the Redensity. Certain areas like the nasolabial area, we oftentimes use RH3 there. And sometimes 1 is enough. Sometimes we need 2. The thing about the RH3 here is it moves with your movement of your mouth. And so it's very, very natural. It's a very nice filler there. So it does depend on how deep, like as we know, every decade, this area, it's kind of a tell of how old we are. As we get older, this gets deeper. And so you might need a little more, like 2 syringes if they've gotten deeper over time. But if you're younger, you may only need 1 or maybe even a half a syringe. It really depends on how deep the wrinkle is that you're filling or how much volume you need.
Yeah. For ethnicity, that's the other thing.
Yeah, it's the area too, every area and how many areas you want to treat. If you want multiple areas, you'll have multiple syringes. But if you're just doing your upper lip, then it's a lot, just 1 syringe. So it just depends on how much.
What do you think of the theory of the vial per decade or syringe per decade?
So I like that concept of syringe per decade, but if you're talking just here, I don't think you ever typically need more than like 2 syringes in there. So even if you're like, 50 or 60 or 70, you're not going to put in 6 or 7 syringes there. So,
sure.
All over the face. For full facial rejuvenation.
I think it depends. Like that, my person that I demoed, the patient that I had, she had great volume in her middle face, and she's like in her late 30s, early 40s. So she did not need any filler there. And you look at my little cheeky poos here. I don't need any filler there either. But I do filler other places. I might do filler here, or sometimes I do filler here. And you can do filler here, because we get, as women, as we age, we get very square, and that's masculinizing. So we like to round it out. And so really it depends, again, on the needs of the patient. Everybody's so individual. And that's the thing. We customize, because we don't want our patients to look like avatars.
That's true.
We don't want to look like unnatural, And this is a very natural product, so you're not going to get with that. It's very dynamic, moves with your natural movements.
So I see we're trying to clear the screen a little bit.
They're doing a vote.
Oh, a vote.
Yeah, so the guys are going to get sent a text message here in a minute about.
You
Okay, yeah. About if you want to be contacted, so you can just respond to that.
Okay,
so I think
what is the healing time of the RHA? Like all the fillers, we say it's really to settle in about 3 weeks time. but bruising can be
You have
about a week's
bruising.
time, swelling week's
We do
time.
have the laser for the bruising too, so.
Yes, but real
that
kind of
helps,
integration. When does the $100 off promotion end? So Friday. It ends Friday. We're trying to make sure we get everybody's questions.
I did light filler, I think
Radius.
Radius, probably before Christmas. Can I add to it now? Yes, you can.
For the
always-
necklace lines, 100%. Yes.
You can always build on fillers, yes. You can,
That is something. That's a good question.
Yeah,
Like,
you can always add-
sometimes we do layers of fillers. You know,
Yeah.
that's kind of an interesting question. Like, there's might be a filler that you want to put deeper, and a filler you want to put on top. And so, sometimes that kind of bi-level is a more sophisticated concept, but we do a lot of that in various areas of the face.
yeah, so you can mix and match like brands and stuff too.
Yeah.
Right.
We're sophisticated.
Yeah.
So we have next question. Ingrid's asking, what's the best for lip lines and those crepey drooping lines around the smile? So I think we just touched on this, but the Redensity is great for those. Some patients have a little more of a line in here. We need something a little more robust, and we'll go into that RHA 2 product. So those are the two, but I would say start with, for the little smokers lines, the Redensity.
Yeah, and I think that's a good point. Like, these lines are called the marionette lines. It's not a great term, but that's what we call them. And we want to come across and fill in here. And that needs something more robust, because a lot of times that occurs because we've lost bone deep in our skeleton, our facial bony structure changes as we age. And so this area starts to involute and become smaller. And so we need to kind of use something more robust. But the other thing to do in this area is to do DAXI. There's this muscle that pulls our mouth down. It's called the DAO. It's an annoying little muscle, because when you go like this, you know, this is the muscle here. And if you put a little bit, like 2 units on each side or 3 units, it helps lift the corners of the mouth. So a lot of times we'll combine, you know, toxin with the products too. And in this case, we would combine DAXI with that.
Yeah. Oh, so let's talk on this. So is DAXI better than Botox
Botox.
or Dysport for the vertical
Like the
lines in
11
front
lines.
of each eyebrow? So I'm assuming this is the classic 11s. So what do you want to say about DAXI in that area?
I don't know. What do you want to say?
Is it better? I mean, this is the thing. You're going to get results from your neurotoxin. That's what's wonderful. But I think every person has a different chemistry and likes their certain one. I can't say that I've had every patient say, I like Botox more than Dysport, or I like Dysport more than Botox, or Daxifies it. I really think it's patient dependent. And I think it's worth trying them all. I really am excited about DAXI because it's the longer lasting of what our choices are now. So for me as a busy mom, that is crucial. And this is the area that most people really are concerned about. So we have a lot of great data. It lasts a long time here. So I think it's worth trying.
What do you think, Chelsea?
Yeah, I mean, I'm excited that, you know, it's the first of the neurotoxins that has been shown to last at least 6 months. So I think it's something good to try moving forward.
So this really points to what an exciting time we're living in.
Mhm.
Like, there's been so many great advances in medicine in general. Like, so many. It's so exciting. Like, we could talk about cancer,
Psoriasis,
breakthroughs.
biologics.
Yeah, like all kinds of things.
That's
It's like
true, yeah.
so exciting to be in it, because we as providers want to come up with things that fix things. We want to help people, right? So the thing I like about DAXI is, we've had it now for a couple of months, and our patients have been very happy with it. Some of my colleagues that were in the early trials with this product really, really like it. And a lot of their patients, have tried it and have really liked it. So some of the things about DAXI is we have a special pricing on it, introductory pricing, so that we use a few more units the way this works, and you get a 6-month last, especially in this area. So the product is definitely as good or better than Botox. It does work. Like, there's no doubt about it. And the studies show it can last in this area 6 to 9 months if you use the right number of units. we're living a time where we're really getting into the fine details of toxins. I mean, for years, people were like not that specific. And now we're really specific about toxins. We're specific about where to put the toxins based on anatomy. Because the other thing that's happened is we've had a rock star anatomist come into the scene who's at Mayo. Sure. And so all of us being like really interested in learning and growing, we're up on all this stuff. And so the precision of placing the toxin, more concentrated toxins so that you get precision with it, has also helped us a lot. And this new product, which has a special protein peptide, which keeps it around the muscle longer so that it lasts longer. So there's all these things, but it's super exciting. And we hope, that you guys, when you come in, we're having this discussion with patients. They're trying Daxi or not trying it. It's really up to the patient.
Yeah, they seem to be really liking it. One of the questions was from Sophia, and she burns through her toxins in 30 days. She works out a lot, and that can happen. That people with a thyroid condition, some people just metabolize their toxins faster. So yes, in the studies, we are saying 6 to 9 months is where the patient satisfaction bar lied, but there are patients that didn't get that amount. They had less, 4 months time. So I hope for someone who, with the traditional neurotoxins that we have, that you go through it so quickly, hopefully this will give you that twice as long effect, if not 3 times as long effect. But it is a good time, like she was saying, with the special to try it. So Sophia, come on in and we'll get you.
And like she said, it's the only one that has that positively protein peptide in it. All the other ones do not have it. So it kind of puts it on a different level than what you're typically getting with your Botox and your Dysport.
Yeah,
so
the delivery
different.
system.
So it's completely different. So it keeps it at that neuromuscular junction longer.
Okay. Okay, so can this be used to contour a jawline? Yes. And if you saw...
Yeah, she did it.
Yeah,
in her video,
Dr. S's swoop.
Yeah.
So, as she said, which now I'm sure patients will come and say, I want the Dr. S swoop. So yes, but you can see in one of the models her before and after, and that was a 30-some-odd-year-old, and she defined the jawline. Yes. So yes, it can be used in the jawline, and that would be the RHA 4.
They're calling it the snatch.
Oh, really?
Can we say
the
jawline
snatch? I know, believe it or not. That's what they call it. Is that a dirty word? I'm so sorry.
No, I don't think so. No.
Anyway, it's basically you can build up the jawline.
Yeah,
sorry.
It's fine. Okay, how well would this work with someone with a fuller face? See that would be
it's all patient dependent. So we just kind of, where you need it is where we'll put it. So if you have, fuller area in your cheeks, we won't, we kind of go to the area that you're deficient and, modify there.
Yeah, or sometimes when patients feel like they're fuller here, we can actually put a little more in, right around the cheek, and it defines the cheek bone better. So right where you would put your blush or highlighter, that stands out a little bit more and then can give you a more, I would say, angled look than your rounder face. So I find patients like that a lot.
Yeah.
Okay, let's see. We've got to get all our questions here.
Touched on the neck.
Views on the neck. We talked about that one.
Yeah, so Melora, we talked about that as far as the tech neck you can do in the lines. The Redensity is really good for that.
Ooh, good one. Terry is asking. She says, I'm 75. Sorry.
Yes.
Sorry, don't say it. 75, and I've been thinking I really need a brow lift. Would this product buy me some time before I would need to do the lift? Do you want to touch on how you filled some temples? And that can give a lift.
There's 7 techniques for filling the temples, and some of them involve going up high or going into the hairline, and that enables actually to lift the jawline up this way and also to lift this up a little bit. I also sometimes will put filler into the eyebrow, and that will actually increase the lift in the brow, and so that really helps as well. And then other things that we do for that would be to do all therapy, which is an ultrasound. It's a sound wave treatment that helps lift the brow, and we're going to be introducing also threads, which will also help with stuff like that. So these are kind of non-surgical mini things.
Mm-hmm. And in the studies for Daxify, when they just treated the glabella, you did get a really nice natural lift in the brow.
That's actually really true. Like a couple of millimeters. If you just treat like here and put a little bit here, you actually get a lift in that. You're absolutely right. That's a good point.
How is Daxify for the crow's feet, and does it affect your vision? No. I was thinking maybe she had a scientific answer for that, but no.
It works well.
It works well. I mean, you could open up your eyes, actually. So when we kind of relax some of the muscles that are naturally cramping down in that area, you do get a little lift. And some people say that they can see better. So I would say your vision can improve. That's it. Yeah.
The thing about the Daxify here is that we can get about, on average, I tell patients about 5 months, and we're using, depending on how much of a fan someone has. Sometimes people have this really large fan, like wrinkles all the way down like that.
Yeah, so fanning wrinkles out is what she's talking about when she says fan.
And sometimes people need like 2 layers because the fan goes all the way out to here. So depending on, again, the anatomy of the person and how this area, because it's a circular muscle, but it also is impacted by the muscle that lifts the mouth. It's called the zygomatic major. So depending on these kind of factors, it works really well. And it depends also on how much movement you want in that area, because some people do not want to be completely frozen in that area. They want to have some natural movement. So that also, you kind of have to kind of figure that these are all questions that we talk about when you come in. And you decide on kind of what kind of results you want. So pretty much we can do so many things. It's really a matter of, what makes sense for you.
Can it be used for under eye? So Daxify, yes. And are you liking Redensity under the eye or RH2? What's your favorite? Because now I say this because we've had RHA 2, 3, 4, and the newest one, Redensity, is come on the scene. So sometimes we evolve with new products. So what are you liking under the eye?
So I do a lot of different products under the eyes. And right now, my favorite is to pre-wet, which means we put some saline in so that it absorbs water, to do Restylane, which is a product I feel very comfortable with. And I think part of, I would do Restylane as my favorite go-to. I've done Velour in that area. I have done Redensity in that area. Again, Redensity, my favorite places for Redensity are the upper lip lines. It's phenomenal in that area. It's also really good on the superficial layer of the temple, the roof, I call it, to kind of soften the temple. It's amazing there.
Or the etched in crow's feet once your Daxify is set.
Yes, you can also do it in these like fine lines here. That can be done with like a little cannula even to subsize, meaning break through the little tethers between the muscle and the skin. Anyway, so yes, tons of options.
Yes. Okay. Oh, so this is maybe a manager question. Do you have to use this now if we've purchased it, or can you book it for a later date? You can book for a later date.
Yeah.
We just got the word. If you have questions,
buy it before Friday, and you can book when you want.
Yeah, you can use it whenever. Like if you want to, buy a bunch and you're going to use it in the course of 6 months or a year. But ask Tanya about that, because she's as you know, she's the go-to. She's the it girl.
So how long does 1, 2, 3, and 4 last? Will they lose efficacy at different times?
One will, because especially we tend to use it in the most mobile area. Yeah. So any type of filler in this area, we really go through faster. So I think that's kind of an unfair question as far as this compared to another filler. But then the other fillers can last up to 15 months. It just depends.
It depends on the area too. Like she said, where you're really mobile and moving, you're going to go through it more. If it's deeper and you're, in the temple or deep in the cheek, you're not moving as much. It's going to last a little bit longer.
So Redensity is a newer product, and so the clinical studies show that it lasts about a year in the upper lip lines. And the other products in the clinical studies, the 2, 3, and 4, the studies show that it lasts 15 to 18 months. But I always tell patients, because I like to under promise and over deliver, because it's really the best way to go. And I always want people to be happy. As I usually tell people, about a year. I mean, that's just so they feel that they haven't been under, things have just not been, I don't know how to say this, but I just want so that they're happy. Basically.
Yeah, you maintain,
they're
really.
they have expectations that are being met.
Right. And
Right,
and there
exactly.
was actually a study that now there's an MRI that can actually visualize your filler. And filler in the mid face is lasting years and years and years. Does it mean that it's still holding up your cheeks or anchoring a fat pad? No, but it's still there, technically under the skin.
That's a good point. Because actually, in the tear troughs, that can even last up to 3 years. When people have surgery, eyelid surgery, and they can actually see the filler there. So the thing is that, like Polly said, is that the projection that you get from a filler, you may lose some projection as the filler goes down in time.
So how is each application catered to the individual? Application of filler, do we
Filler.
think?
No, that's what I'm thinking. Yeah, I mean, basically, it's patient specific. So you come in, we assess you, we see where your volume loss, where your deficits are, and we go from there. So it's always best to come in, do the consult, and then see what you need. So that's we specify your treatment person by person. So not everyone gets the same thing, obviously.
Yeah. Or what bothers you? If you're
and
tired, then we'll start with that.
Mm-hmm.
This is a great question for you, Dr. S. How does this compare to Radiesse? You had recommended for this patient the Radiesse for her filler. Just wondering what would be better.
So I think Radiesse is an amazing product. I love Radiesse. Like, do you love Radiesse?
I have it in my neck.
I know. I have it in her necks.
Yes. But yes, I would still top off my necklace lines, specifically for the neck, right? That's where you're using it the most.
No, I use it anywhere, actually.
Okay, so I'm not sure if you're referring to face or neck, but answering that question, how would this be different? Because you did touch on how it being a stimulating filler.
Yeah. So I mean, Radiesse has a high G prime. It's got a lot of it's a robust product. So you would use it in areas where you want a robust product, or
when she says G prime, where you want to lift, you really want to lift the skin.
And then we do a lot of dilution of Radiesse now. It's called dilute and hyperdilute Radiesse. So meaning a little dilution or a lot of dilution. In the neck, we do more dilution. In the face, we do less dilution. And we use it in that context to stimulate collagen. So, and someone who has a very thin face that really needs, and the skin is very thin, we will use it to thicken the skin and to create collagen. So it depends on what we're trying to achieve. As I said, there are different fillers for different applications. And the really cool thing is we have a lot of options and we can do a lot. Like, it's just incredible the things we can do now. It's really fun.
Okay. Do patients metabolize a filler like RHA or RH1 faster than something than RH3? Or is it just dependent on each individual person?
You touched on this before.
I think it's actually the answer is both. It's the Redensity of the RH1 goes faster because it's thinner and it's usually used in a very mobile area. And also, if you're very athletic and you're doing a lot of movements, things might go away faster.
Yeah. And the way it's made, it's not. It's made a little bit different than some of the RHA2 and RHA3 and RHA4. The Redensity. I'm speaking about the RHA1. So it's not as it just doesn't lift the skin up. It's very mobile. It just integrates into the skin. So bunny lines, best option. So I'm a neurotoxin, I'm believing. So to answer your question, so the question was, what's the best option for bunny lines? So we like to use a neurotoxin there to stop the movement lines. If you try to put a filler in there, it's a little more difficult. But a neurotoxin like Daxxify, Botox, Dysport does a great job.
Yeah, you wouldn't want to use a filler in the bunny lines because there's some super important vessels underneath there. And with what we do with fillers, we want to be mindful of the anatomy. And so the bunny lines are caused by movement. So if we stop the movement of the muscle that is lifting the nose, right? I have bunnies. If you stop the movement, then you soften the lines. some areas we both fill and we stop the movement. Like here we can fill and we stop the movement with toxin. But this area I would not put filler in there. There's some really important vasculature we want to completely avoid.
Yes.
Yes. We call those no-go zones.
No-go zones, no-fly zones.
Did
Yes.
I answer the state?
No.
Get back to it.
Oh, yeah, we'll type in that answer. Let's do. So, how will the new toxin work across the forehead? Very well. So, actually, with the forehead, the studies show a very natural look. It doesn't last as long as the glabella area. It's similar to the crow's feet in its duration, but it does give a very nice natural outcome. But what are the possible side effects of fillers, we think? Daxxify, we think? So one of the questions is, what are the possible side effects? So with the fillers, like all fillers, you can have bruising, swelling. There's always a possibility, as she was mentioning, with vascular, we have veins and arteries and just blood vessels all over our face. So there is a very rare chance that we could inject some of the product into that. We have the antidote to that right next to us at all times to avoid any complications, which isn't true of every office. So we are very prepared like that. We, what else would be something that someone would be concerned most about side effect wise?
I think, the normal side effects or the possibilities from any time you introduce a needle onto the face is bruising, right? So we really try to minimize that. And if we do get bruising, again, we try to laser it to help patients with that. We a lot of times use cannulas, which make it very safe. There's some areas and some techniques that we don't like to use cannulas with, so that's a little bit, we will pull back and make it safer by, we call that, withdrawing the needle a little bit, and we can see if we're in an area that we don't want to be in, or a vessel, for instance. And then we have all done training on the new ultrasound for the facial anatomy. And I've trained with the world's expert in it multiple times. I've spent time with her. And we have an ultrasound in the office. And if we have any concerns or issues, we can actually see the filler, and we can actually see the vasculature and the patterns of the vessels. So we can put the antidote, which is called hyaluronidase, which dissolves the filler, into the area, and sort of take care of that. So that's kind of like the number one concern of the filler in the filler world. But there are things you can do, and you have to be aware, and we're all very aware. And we're not worried about that, because we have
all practiced and have the tools,
and
yes.
We really know our anatomy.
Safe, yeah.
The anatomy is key.
Anatomy
is king.
Yeah.
King. I tell you, it's not king. True. It's queen. It's the prince. It's the princess. It's princessa. It's everything.
So that was our last question.
And I think we have one more that we're going to answer. How much is one syringe of Redensity? What was that?
Just a reminder.
Oh, I'm interested in lift on the cheeks, and lips need touch up. So yeah, so it's $8.50, and then by Friday, if you get it, it's $7.50. So yeah, that's it.
Yeah,
I think they're done.
Yes. So I just wanted to thank everybody for joining us. This was super fun for us. This is we never get a chance like this to sit together.
Yes.
And it's really fun. It was really great for us. I hope you learned some things. Our goal is to be of service to you in any way that we can be. And education, I think, is really important, not only for us to be educated, but to share and communicate, education and what the newest thought process or the latest treatments and techniques. And this is part of, hopefully we'll be doing more of these. And thank goodness we're going to be back live in March 2nd, in an in-house where we'll have a catered event, and we'll be doing a demos and lectures too. There'll be a slide presentation on some of the top things that we're doing in the practice. So, and we'd love to hear from you on what things you'd like us to talk to you about, and do more of these as well, a mix of in-house and these. So we're really excited on that. And then also we'd like you to call and set up a consult if you're interested. They're all complimentary, and Tanya can help you with that. And yeah, we're really excited. And again, thank you so much.
Yeah, thank you.
And then we will announce the winner too for the drawing, the raffle.
2 winners, right?
There's two,
Yeah.
yeah. So we'll announce that.
Each winner will get 1 syringe. So, you get to pick an area. Yeah. All right. Bye-bye. Thank you so
Bye.
much.
Take care.
And
Good night.
I think there's still some more questions that we can type and answer to people.
No, I don't think so.
Oh, no.
This
we
was
can't.
just for yours.
Oh, okay. Just
Sorry.
my one question. Okay.
Just remember her.
Yeah.
Okay, bye, guys. Thank you so
Bye.
much. Have a great